It's a reminder that it's something that government has to do, and I believe very strongly we can't do without good and active government. But it's also a reminder that whether we're talking about creating health or education and life chances, government can't do it on our own. And if we try to, we won't have as much impact if we work with partners. So I just want to say a massive thank you to everyone here at the club for the work that you do as a proper community-rooted club. This is a town that occupies a special place in my heart through a lot of happy memories. From visits to Pleasure Beach as a kid, I've got family up the road in Preston, to NUS, National Union of Students conferences in Winter Gardens during my student years, some of which I can still remember. But as Health and Social Care Secretary, Blackpool is on my mind for less happy reasons. Its health outcomes, which are not only poor, but unjust. England is not an especially large nation, yet the inequalities between us are huge. Travel 30 miles down the road to Ribble Valley, and men live for 8 years longer. A baby girl born here in Blackpool will live 7 years less than one born in Wokingham. She will fall into ill health 18 years earlier in life. As a report by the Chief Medical Officer on Health in Coastal Communities puts it, in many working class towns like this one, people are growing old before their time. And it's hard to think of a more damning assessment of the Conservatives' record in office than the fact that even before the pandemic, life expectancy had stalled, and the gap between the health of the poorest and wealthiest parts of our country widened. These stark health inequalities are not just down to the health service alone. They're also caused by poverty, a lack of good work, damp housing, dirty air, and the sporting, travel and cultural opportunities which are afforded to the privileged being denied to far too many. It's why I've been driving the NHS so hard on reform, trying to improve productivity and cut waste, because I know that every pound we spend on diagnosing and treating illness is a pound that can't be spent on tackling the causes of ill health. So in the coming days, we'll be publishing our 10-year plan, which will set out how this mission-driven government will tackle illness, keep disease at bay, and reduce the health inequalities that shame our society. Our 10-year plan will not just be a plan for the NHS, but a plan for health. It will tackle illness at source through a whole society approach, with a shift in focus from treating sickness to preventing illness in the first place. And already this government's taking action. The Education Secretary, Bridget Phillipson, is rolling out primary school breakfast clubs and expanding free school meals to millions of children so they walk into the classroom with hungry minds, not hungry bellies. Angela Rayner, our Deputy Prime Minister, is building a new generation of homes, and alongside our Business Secretary, Johnny Reynolds, introducing sick pay from day one in the job. The Chancellor has given workers on the minimum wage a £1,400 pay rise this year. The Work and Pensions Secretary, Liz Kendall, is giving disabled people the right to work so that they can take up a job opportunity, knowing that if things go wrong, they can go back to the support they had before without the jeopardy or fear of missing out or being back to square one. Our Energy Secretary, Ed Miliband, is extending the Warm Homes discount, helping keep millions more households warm this winter. And our Environment Secretary, Steve Reed, is cleaning up our rivers and seas from sewage. So you can see with just those steps we've already taken in less than a year in office that Keir Starmer's Labour government is determined to lift people out of poverty, tackle inequality, and improve the health of our society. It's what Labour governments do. And today I want to set out how our reforms to the NHS will fundamentally improve the health of working class communities. The NHS was founded to end grotesque inequality in access to healthcare. Before 1948, working people avoided the doctor unless they absolutely needed to see one because of the costs being so prohibitive. Diseases such as rickets, scurvy, and diphtheria were common among children. The solution was revolutionary: universal healthcare, publicly funded, free at the point of need. And as the NHS's founder, my Labour predecessor, Nye Bevan, promised, the NHS lifted the shadow from millions of homes and eradicated the fear of illness from people's hearts. It's been one of the great levellers of our society, the greatest institution this country has ever built. But as the NHS was neglected and left to decline after 2010, it contributed to the widening gap between rich and poor. Waiting times soared, and a two-tier healthcare systems emerged, where those who can afford it are paying to go private, and everyone else is being left behind. Now, there are some on the populist right who argue that this is a good thing. They say patients going private reduces demand on the NHS. Reform promised to give tax cuts to private healthcare users to encourage the exodus. But this government sees it as a sign of failure. The NHS was never intended to just be a safety net for those who can't afford to pay. Such a system would be doomed to ever-declining quality. Taxpayers would question, why continue to pay for a service that we don't use? So inevitably, the NHS would become a poor service for poor people. But since its foundation, we've always aspired to an NHS that is universal in provision, so that everyone receives high-quality care. By the time the last Labour government left office, the NHS was so good that use of the private sector fell off a cliff because patients didn't need to pay to be treated on time. We did it before, and we'll do it again. With Labour's plan for change, the NHS is on the road to recovery. Since the general election, we've recruited an extra 1,700 GPs onto the front line, delivered an extra 3.6 million appointments for planned care. We promised 2 million in our first year. Diagnosed an extra 187,000 suspected cancer patients on time. We cut waiting lists in the month of April for the first time in 17 years. We've cut waiting lists to their lowest level in 2 years, and we've cut waiting lists by almost 250,000 cases. Each one of those patients we've taken off the waiting list is someone who's now free from pain, in some cases, disability, because of the decisions that we've taken. But I'm not here today to do victory laps. I know that for the almost 250,000 cases that otherwise would have been on those waiting lists, for the people who've already been seen faster, there are over 7 million still on waiting lists. We've done a lot, but there's so much more to do, especially for towns like Blackpool. And while there are so many social determinants of ill health that need to be addressed, the fact is that the NHS doesn't do enough to address the unjust, unequal way in which illness presents itself in our country. In fact, sometimes it entrenches it. General practice was neglected and declined across the board for more than a decade under the Tories. But that doesn't explain why there are 300 more patients per GP in the poorest communities compared with the richest. As I spoke about on Monday, far too many parents and their babies have been failed by maternity services. But failing services don't explain why black women are almost 3 times more likely to die from childbirth than white women. Black men are twice as likely to get prostate cancer as white men. But given we know the risk is greater, and given we know how to catch cancer early, that doesn't explain these sorts of inequalities, given the evidence is there. So those in greatest need often receive the worst quality healthcare. This fact flies in the face of the values upon which the NHS was founded. So a core ambition of our 10-year plan will be to restore the promise of the NHS, to provide first-class healthcare for everyone in our country, whoever you are, whatever your background, wherever you live. In the summer of 2022, 2 future Prime Ministers were competing to take the helm of a sinking ship called the Conservative Party. Rishi Sunak was trying to catch up with Liz Truss when he stood in a garden in Royal Tunbridge Wells and addressed a group of Conservative Party members. Boasting about his record in the Treasury, he said, "I managed to start changing the funding formulas to make sure areas like this, Royal Tunbridge Wells, got the funding they deserved. Because we inherited a bunch of formulas from the Labour Party that shoved all the funding into deprived urban areas. That needed to be undone. Now, despite the bribe, Tunbridge Wells still voted the general election to boot out Mr Sunak, but that's not quite the point I'm making here this morning. The serious point is that while the NHS declined for everyone under the Conservatives, the decline was felt more sharply in some places than in others. So it's fallen to this government to rebuild the NHS for all of us, and it's right to start where the need is greatest. You might call it the reverse Royal Tunbridge Wells strategy, the detourification of the NHS, and it's already begun. We've sent crack teams of top clinicians to hospitals around the country where the highest numbers of people are off work, off sick, to help them cut waiting lists faster, therefore getting people not just back to health but back to work. We're delivering on our manifesto commitment to fill in the dental deserts by paying dentists extra to come and work in underserved areas. And today I can announce we will go further. In recent years, billions of pounds have been put aside for NHS trusts who let their spending get out of control and run up deficits. It's essentially a bailout fund for poor financial management. So I'm working with Jim Mackey, the Chief Executive of the NHS, to end that culture of rewards for failure. Thanks to the reforms we've made to bear down on waste, the fund will not go to trusts which run deficits this year. We can reinvest that money in the front line so it isn't spent on rewarding poor performance, but to improving poor health. The £2.2 billion will fund more effective care, such as innovative medicines, modern technology, and services that keep people out of hospital, all going to places where they're most needed. GP practices serving more deprived areas receive 10% less funding per needs-adjusted patient than poorer parts of our country, and, as I mentioned, have 300 more patients per GP as a result. So working with the BMA, we'll review how health need is reflected in funding for general practice, known to the policy wonks in the room as the Cahill formula, with a sharp focus on money actually following need. Where health needs are greatest and GPs are fewest, we will prioritise investment to rebuild your NHS and rebuild the health of your community. As I said in my first week in this job, the NHS has a part to play in dragging our country out of the sluggish growth and low productivity this government inherited. It's the biggest employer in many towns in England. In coastal towns like Blackpool, where far more people are off work due to long-term sickness, the NHS has got a dual role to play. Not just getting patients off waiting lists and back to work, although we're already doing some of that. The health service should also act as an engine of local economic growth, giving opportunities in training and work to local people. Working in the NHS is rightly seen as a high-status, secure job, but for many people, they see it as an unachievable job out of their reach. On a visit to King George Hospital in my own neck of the woods on the London-Essex border, I saw firsthand a brilliant programme called Project Search that supports 17 to 19-year-olds who are learning disabled and or autistic. It gives them internships that give them experience of a wide range of NHS jobs, as well as coaching on things like preparing a CV and interview skills. One of the young people I met, Mohammed Patel, shared with me how much he loved, and I could see when I was talking to him and shadowing him one morning, how much he loved what he was doing and how much he really wanted to work for the NHS. Months later, he messaged me on Instagram to tell me he's got a job and is now a full-time worker in the NHS. And he's not the only one. Project Search aims to help every young person on their programme get a job either in the NHS or with another employer, and it is succeeding. So today we're launching a new pilot backed by £5 million to help recruit an extra 1,000 people to the NHS from areas that are worst hit by unemployment. The programme will offer a ladder into the world of work for people who find it hardest to break out of unemployment, including the over 50s, unpaid carers, and disabled people. They'll gain the skills needed in health and care, alongside support with job applications and work placements, kick-starting what will hopefully be a long-term and rewarding career in our health and care sectors, where we desperately need people, and where they will then more than repay that investment that we're making in them today. Finally, our 10-year plan will address one of the starkest health inequalities, which is often written out of this conversation, which is the unequal access in our society to information, choice, and control over healthcare. In fact, I think it applies to so many aspects of our lives. When I was diagnosed with kidney cancer a few years back, colleagues in Parliament asked where I was being treated and who my surgeon was, because they wanted to make sure I was receiving the best possible care from the best possible surgeon. Now, luckily in my case, the NHS had already assigned me to a world-class surgeon who saved my life. But those are questions that my mum, a cleaner here in Lancashire, would never think to ask and would certainly never be asked. When the wealthy or well-connected receive a diagnosis, they often already know the best surgeons and can push to get the best care, or they certainly know someone else who does. But working class people from normal backgrounds can't. If the wealthy are told to wait months for treatment, they can shop around. But most working class and people from normal backgrounds can't. And if the wealthy want instant information about their own health, they can pay for an app that allows them to speak to a doctor over the phone 24/7. But there are a lot of working class people from normal backgrounds who can't afford to do that. This is not just grossly unfair, it presents an existential risk to our health service. More than any other age group, this generation of young people are prepared to opt out of the NHS. Last year, the biggest increase in private hospital admissions was for people under the age of 40. Almost half of young people say they would consider going private if they needed care. The NHS feels increasingly slow and outdated to a generation that organises their lives at the touch of a button. If you get annoyed at Deliveroo not getting your dinner to you in less than an hour, how will you feel being told to wait a year for a knee operation? A failure to modernise risks this generation walking away from the NHS, first for their healthcare and then with their taxes. People won't accept paying higher and higher taxes to fund a health service that no longer meets their needs. And the lack of control people feel over their own lives is made worse by an analogue computer says no NHS. We can only close this inequality and shut down this risk to the NHS's future through a revolution in patient power. So the ambition of our 10-year plan is nothing less than to provide NHS patients with the same ease, convenience, power, choice and control that's afforded to private patients. The good news is that technology gives us the opportunity to democratise healthcare in a way that wasn't possible before. It can empower patients with choice and control and make managing our healthcare as convenient as doing our shopping or banking online. Technology can be the great leveller. Look at what Martin Lewis, the money-saving expert, has done for personal finances. Loads of people who sign up to his newsletter, and I am one of them, could never afford their own financial advisor. It's simple and easy to make your hard-earned money go further if you've got access to the right advice. Our 10-year plan for health will do the same for NHS patients, giving them easy access to information to help them improve their health. We'll introduce a tool on the NHS app called My Companion. It will provide all patients with information about their health condition, if they have one, or their procedure, if they need one. It will get patients answers to questions they forgot to ask or felt too embarrassed to ask in a face-to-face appointment. So the next time you're at an appointment and you're told something that doesn't sound right, you will have at your fingertips the information you need to speak up confidently with the other expert in the room. And we will give every patient meaningful choice through a new tool called My Choices. It will show patients everything from their nearest pharmacy and its opening hours to the best hospital for heart surgery across the country, with patients able to choose based on their preference. If NHS providers know that their waiting times, health outcomes of their patients and patient satisfaction ratings will all be publicly available, they'll definitely be inspired to respond to patient choice raise their game, and deliver services that patients value. And look, I appreciate not everyone wants a choice. Many just want their local hospital, and they want it to be good. That's fine, and that should always be the default option. But we know that at the root of many inequalities in health outcomes is a failure to listen to patients. A one-size-fits-all approach often misses the distinct needs of women, where women health hubs are very important, people from black and other ethnic minority black backgrounds, or people living in rural communities. And we will only deal with the grotesque health inequalities in our society if we empower all patients. In the months leading up to the founding of the NHS, Nye Bevan said, "For a while, it may appear that everything is going wrong. As a matter of fact, everything will be going right because people will be able to complain. They complain now, but no one hears it." He promised that a national health service would put, and I quote, "a megaphone to the mouth of every complainant so that it can be heard all over the country." So for more than 100 years, it's been the historic mission of the Labour Party to put power in the hands of the many, not the few. We've always believed that public services exist to serve the needs of all pupils, all passengers, all patients, above all else. And the driving force behind the work this government does every single day is the principle that whatever class you're from, whatever your background, wherever you live, everyone deserves world-class services. We expect nothing less for our country than we expect for ourselves. And that is why we're determined to get our NHS back on its feet, make sure it's fit for the future, and put power in the hands of every patient. Thank you.